Hello everyone, good afternoon to all of you. This is Dr. Mansi from Homeopathy 360 and we're back again in the Homeo Talk 2025 webinar series from Homeopathy 360 in collaboration with Parul University. We are very proud to say that on the every day we have so many passionate homeopaths with us and their passion for teaching students is really incredible. And today we have Dr. Amar Thakkar, Professor, Department of Pathology, HRD, plus with 25 experience of academic and professional experience. He has published various articles on national and international level. He has presented 5 research projects paper presentation in national and international conferences. We are very happy to say that today we have Dr. Amar sir on the topic role of pathology in homeopathic practice. We are very happy to serve. We are very happy to have you, sir. Please begin your session. We are very eager to learn from you.
Very good afternoon. Thank you, Dr. Mansi Tyagi, for your kind words of introduction. Today, we are going to have an insight into one of an important topics which can help homeopaths, students, physicians, and can share a new light with respect to use of pathology in homeopathic prescribing.
Yes.
So today I am going to discuss those salient features which will help any physician or a student to understand the role of pathology as a subject and knowing how the pathological changes can influence homeopathic prescription. So I'll share my screen.
Yes, sir.
Is my screen visible?
Yes, sir. Your screen is visible.
Okay. So let me first introduce myself. Myself, Dr. Amar Thakkar. I'm working as Professor HOD in Department of Pathology and Microbiology at Rajkot Homeopathic Medical College, Parul University. Going straight into the topic, I will first introduce how we are going to study different aspects of pathology which are going to make a bridge between the fundamentals of homeopathy and the subject of pathology. These are 7 different points or features in which I have divided the topic which we are going to study at length. The first is pathology since evolution and its development. Here we will have glance at how right from the start of evolution till today's time, pathology has evolved in relation to the field of medicine as well as homeopathy. The second topic is describing about how different pathological changes are correlated in homeopathic philosophy. Very importantly, we encounter patients who come to us after taking treatments from other systems of medicine and they have suffered from palliation and suppression. So that is an important aspect which has a great correlation with pathological changes. That is the third part. The fourth part is what is needed in today's time when we need validation from other systems of medicine. It is evidence-based medicines in which without pathology, or rather I'll say investigations, homeopathic system of medicine will not be able to fulfill those criterias which are in the general perception of people's mind. The fifth topic is relationship between cause and the pathological changes. The sixth, probably the most important part, which has a definite correlation, the miasms, the fundamental cause, and how well, even before knowing about the word pathology, Hahnemann has come to this realization that miasms are the sole cause, or rather, I'll say, important cause as far as chronic disease are concerned, and how beautifully in chronic diseases the changes related to this miasm can be correlated with our understanding of pathology. And lastly, after knowing about all these aspects of pathology and correlating it with homeopathic fundamental principles, we come to the end part where ultimately each and every physician is going to make a totality of symptoms. And how this understanding, which we will study today, will help us in making a better totality of symptoms, because that is always the final goal which every homeopathic physician strives for. So let us dive into the first aspect, pathology since evolution and its development. We have to understand that the time from which human beings have evolved, they have always tried to find out solutions to the problems which we have faced. And all those problems essentially deal with survival. So, as far as survival of human beings as a species is concerned, we had a major enemy in form of disease. And our fight against disease has developed to a considerable extent where over a course of time we have been able to tackle a large number of disease conditions, and in this understanding about pathology is one of those important reasons because of which we have to, or we have made a considerable progress, especially after the discovery of microorganisms. So you can say that microscope or invention of microscope was one of the fundamental uh, discovery which has caused great progression in our understanding of disease processes. However, again, from homeopathic perspective, we must remember that we must not give or attach too much importance to this microorganism. From the homeopathic perspective, we must always remember that the totality of symptoms is of prime importance, irrespective of whatever pathological symptoms or pathological changes are there. However, it must be remembered that you cannot completely ignore pathological changes in form of structural or functional changes. So you have to give due credence and importance, even though when we did not have the knowledge about pathology, if you study the original source books, you will find there is hardly any mention of any kind of structural pathologies. Of course, superficial structural pathologies like warts or eczema, etc., were identified. But deeper pathologies, which needed microscopic findings, were not evident when homeopathic system of medicine was discovered. But since now we have reached to that particular stage in the field of medicine, we must give due credence and importance to it. Again, here you must understand that when Hahnemann started treating patients with homeopathic medicines, with dilutions, with potentized medicines, there was no question of giving importance to any kind of pathological process. But it was again seen that even though those pathological processes were not given importance after administration of dilutions, potentized medicines, these pathological processes also were reversed. This has to be studied, this has to be understood in terms of importance of fundamental principles of homeopathy. And in this, you cannot bifurcate or bypass any of the fundamental processes, but especially I will give more importance to one of the fundamental principles, which is the doctrine of vital force. Any disease process in the human body is attributed to derangement of vital force. Likewise, in orthodox system of medicine, any disease process is attributed to pathological changes. So this correlation forms the basis on which these two systems have thrived and have been able to give solutions to disease processes, patients, and give them effective treatment. From homeopathic perspective, it must be remembered that any kind of appearance of symptom, it is possible to trace back to a change within the body. Now, this does not apply to all symptoms. You have to remember this because homeopathy is a system of medicine which does not believe in generalization. So, you cannot expect that whatever you are talking in terms of disease can be applied to each and everything. So, that is the reason why, though here it is written that appearance of symptoms which are common can be usually traced to pathological processes. It cannot be true for every symptom. But let us try to understand this with a simple example. Pain with swelling in inflammatory pathology. Let us say you are suffering from a condition conjunctivitis. So you have eyelids which have undergone swelling, and you have pain. So these are two important symptoms which you find as common symptoms, whereas they are common because of the underlying pathology. When you have studied inflammation under pathology as a subject, you have studied that pain and swelling are cardinal signs of inflammation. So here this premise that appearance of common symptoms can be traced to pathological processes true. However, we know we cannot prescribe on the basis of common symptoms. But common symptoms can be made uncommon, individual symptoms, by finding something which is individual. So in this case, let us say conjunctivitis, there is a stinging sensation and there is a peculiar modality, amelioration by heart. So what you have done here is that you came to know that the symptoms of pain and swelling are common because of a pathological process, inflammation, and you have made that uncommon. This uncommon symptom can be used in adding to totality of symptoms besides other symptoms of the case. So you must remember that whenever you encounter any case and do the process of case taking, you are also understanding the pathological process. And this pathological process can help you to understand the cause of origin, as well as it will differentiate common symptoms from individual symptoms. Now, when you are talking of prescribing any medicinal substance, first of all, after you have done the process of case taking, you must think and understand as to what is your scope in terms of possibility or cure. That can also be many times understood from pathological processes, because when you study any pathology, you will come across words like reversible and irreversible. So, under certain predestined conditions, there is always a possibility that irreversible changes will be permanent even if you give them a medicine which is well selected. So, pathological changes can help you to determine ultimately whether you will be able to make, or you will be able to restore this patient's condition of health or not, or you will need palliation. It also will determine whether the original structure and function of that part, organ, or system can be restored, will be restored, or not. In any disease condition, you must know that giving medicine is not only sufficient. It includes what we call proper management with timely intervention. Again, this can be better understood with respect to the changes which you observe in pathological processes. Like, for example, if you have given a medicinal substance with great care without making any mistake in a proper potency, and you find that the symptom has disappeared. Now, simply relief or disappearance of symptom cannot be the only criteria for cure, because disappearance of symptoms, according to homeopathic philosophy, does not always mean that a curative action has taken place. So, knowing that a symptom has disappeared, you might think from the purview of pathological process whether suppression has taken place or not. How you can be sure, how you can know whether such kind of palliation or suppression has taken place or not? We have the help of modern investigative methods. However, this again, as I told you, must be used with great caution, because it is not that every time the same kind of possibilities may take place. Like, for example, you have given a medicine on the basis of symptom totality for a patient who is suffering from hematuria. Now, that hematuria has occurred because of a renal calculi. You have given the medicine, hematuria stops. Now, whether that calculi has been removed or not can be known only if X-ray or USG, that is sonography, which is done. But now it entirely depends on so many factors whether you are going to advise that investigation or not. Because any medicinal substance, in order to produce as changes in drug proving, requires a certain amount of time. The same kind of amount of time it will require to reverse a process, to cause disappearance of symptoms. So it is highly possible that the disappearance of symptom of hematuria might have taken place in your patient of renal calculi, but whether that particular calculi has been removed or not, even if it is not removed and hematuria has stopped, you will keep on giving medicine in order to remove that calculi. that is an indication, that is a, you can say, possibility which has always to be thought of. And this correlation again helps you to understand the working of homeopathic medicine. Now, this particular is an example of a case of eczema who is partially treated with partially similar medicine. So there will be disappearance of eczema from skin surface. But this disappearance is actually a suppressive effect, which has resulted into formation of a fibroid in the uterus. Now, this correlation between disappearance of eczema and fibroid is not understood in other systems of medicine. But this appearance of fibroid has resulted from effects of suppression, has to be kept in mind. Otherwise, it will be treated as a separate disease condition. And this example again enhances, emphasizes the effect or relationship between those kinds of disease conditions which possibly may give rise to palliation and suppression when medicinal substances are not used effectively. The next part which we must always remember in evidence-based medicine, if you are giving treatment and you want validation, then you must go along with investigations which are needed, necessary in any given case. Like for example, a case of iron deficiency anemia. When you give medicine and expect the symptoms of anemia or symptoms arising because of anemia to go away. If the symptoms have gone and you again advise the investigation, they must be able to reflect significant change. This can be a very important step for validation from other systems of medicine. Many a times you must remember that with the help of pathological investigations, whether they are for blood, urine, X-ray, USG, you will not be able to distinguish the kind of change which you expect and what the patient reflects in terms of symptoms. That can again be verified with the help of pathological investigations. Another important aspect for studying the pathological aspects of disease process is with reference to giving importance to etiology and cause. Let us try to understand knowing the cause and pathology in three different patients who are suffering from epilepsy convulsions. Let us say these three patients have different cause. One patient is suffering because of epilepsy since he is not having sufficient sleep daily. Second patient is having or suffering from epilepsy after head injury. And third patient has got epilepsy or it started only after suppression of anger. Now, all these three patients are suffering from the same effect. If you remember, there is a special mention about the topic, the cause and effect phenomena. The causes are different, the effect in form of conversion is same. Now, what makes this different in terms of the entire disease scenario is that when the exact cause is found, you can expect that some form of change has taken place in the body. Like in the first instant, because of lack of sleep, there is biochemical change. In the second instance, there is physical injury, which has resulted into structural changes within the brain. And in the third case, there is a psychosomatic factor. Again, when you have known that it is due to a physical injury, it will be evident on CT scan or MRI. And likewise, the medicine which you will prescribe will be different. The medicine on the basis of psychosomatic plane will be different. Medicine on the basis of physical injury will be different. And the medicine on the basis of lack of sleep causing biochemical changes will be different. This is one such case which was published in the National Journal of Homeopathy before a few years. This is my own case. Here, that same phenomena has been explained, that physical injury leading to epilepsy. Another case in which a person tried to commit suicide by taking Begon spray had produced pathological structural changes in the GIT. I was prescribing on the basis of psychosomatic illness, but actually it was a pathological injury which was caused by ingestion of Begon spray. So that changed the entire perspective of treatment. Now we come to a very important and the last part in understanding the relationship, which is the miasm and pathology. From the original texts written by Hahnemann in form of chronic disease or materia medica pura, uh, and with the development of the field of medicine, especially in the pathological aspect, when you combine these two uh, studies or knowledges, you must be able to find out the salient features which exist between these two. And one of those important considerations is that any pathological change is basically a defense mechanism to protect systems and organs without causing more discomfort or harm. But over a period of time, these pathological changes go beyond a certain boundary, and then we identify or we call them as disease phenomena. But if you look closely, any pathological change in its initial stages is almost always a defensive mechanism. The same is true for miasms. How? Any type of physiological or functional change which results into inflammatory or irritative pathologies is usually corresponding to psoric miasm. Whereas constructive defensive mechanisms, which are usually growth pathologies, which may also include excesses or deficiency, correspond to psychosis. Whereas defensive mechanisms in which destructive pathologies are characterized by distortion or disfigurement, or sometimes complete loss takes place. This corresponds to syphilitic miasm. This association is not absolute. Remember this. This is only for a sake of better understanding. Because when we talk of changes, we always study changes in terms of manifestations and expression, not changes in their literal sense. Like, for example, inflammatory pathology can manifest with so many different expressions. So, while you give credence to any expression, then and then only corresponding miasm can be thought of. So this is merely suggestive, it is not absolute. Remember this. How this particular functional changes corresponding to SORA are in terms of spasmodic pains, neuralgias, convulsions, behavioral or emotional changes. When you talk of specific pathological conditions. They are in excessive forms in terms of hypertrophy or hyperplasia of cells. Or when you are talking of skin conditions with reference to warts, skin tags, polyps, then they are psychotic manifestations. Excess of salts like sodium, potassium, and calcium, and many other biochemical substances within the body minerals come under the purview of psychotic manifestation. Just like excesses, deficiencies also come under psychosis. Reduced calcium deposition, or in terms of manifestations of hypopigmentation, anemia, are all manifestations of psychosis. Syphilitic, as we know, destructive miasm, characterized by necrosis, epolysis, gangrene, ulcerations, or even destructive changes which we find in disease like rheumatoid arthritis or motor neuron diseases, which are usually involvement of immune system, which are characterized by permanent irreversible changes. As I told you, these are merely suggestive. You cannot exactly. This has been explained with the help of an example. A patient complaining of vertigo can be wrongly interpreted as having psoriatic miasm because it is functional. But there is an underlying brain tumor which can be only identified by a CT scan or an MRI or maybe some other pathological investigation. So then there is a possibility that it can become a psychotic manifestation. So this is one example which helps you. Like this, as I told you, expressions of disease in terms of knowing their totality is very important. Simply a pathological change is present. You cannot label that this miasm is present. So now we come to the final part and conclusion as to what we have highlighted today in terms of study of pathology with respect to miasms, uncommon symptom, causations, or the effects of suppression and palliation. So when you summarize all this, you come to the final realization that ultimately a cumulative effort needs to be made in terms of our understanding so that it ultimately leads us to a better understanding of any given case, especially when it represents to us with pathological changes. So this is in a brief what I would like to share in terms of relationship between pathology and homeopathy. With this particular slide, I would like to end today's presentation by thanking you all, whoever are present here with me today, listening, my students, physicians, colleagues who have joined here, to our president, Sir Dr. Devanshu Patel, Parul University, for providing us continuous motivation. To Dr. Hitat Mehta sir, Principal at Rajkot Homeopathic Medical College. To Dr. Purav Desai sir, Dean of Faculty of Homeopathy, Parul University. Thank you all for giving me this opportunity and allowing to share my views on this particular topic.
Thank you so much, sir, for providing so much information on pathology. And today we learned how pathology is so important in our cases, in a homeopathic approach as well. It is very important to learn the cause, to it is very important to diagnose the disease and to correlate with our totality of symptom, miasms, diagnosis, evaluation. It is very important. Uh, and sir, we learned also that it's not just about the medicine. It is first of all important to guide the patient that what is the cause of your suffering. So it is very important that we learn first, and then we can guide the patient also. Thank you so much, sir. Now it's my request to all the participants that please ask any question and any queries if you have. We are open for the open discussion. So, sir, we have one question from Bibu Prasad. Please correlate irreversible and reversible pathology with homeopathic selections.
Uh, Whenever you are talking of irreversible pathologies, there is a special part in our homeopathic philosophy called as difficult and incurable cases. Now, according to philosophical point of view, whenever you are talking of any irreversible pathology, the name itself suggests that it cannot be reversed. However, there have been many instances and evidence-based cases also available in homeopathic literature and with so many of our learned colleagues, senior doctors, who have been able to make changes in irreversible pathological conditions also. So primarily, a homeopathic physician who is undertaking any kind of case must be able to distinguish as to what he can cure. If he finds it himself unable to, or he thinks that this is an irreversible pathology in its broadest sense, and he cannot produce any kind of reversal, then he should not attempt or give false hope to any patient that though this is an irreversible pathology, I will give you medicine and it will be reversed. No,
Yes.
that kind of false hope should not be given to any patient. He should be explained and given due reference as to why you are considering it as an irreversible pathology.
All right, sir. Next question is from Huda Siddiqui. Any side effect of homeopathic medicine in chronic skin disease since long-term use and wrong selection of similibum medicine?
There will always be repercussions whenever you are selecting a wrong medicine was the question, I suppose.
Yes, sir. He's asking, is there any side effect of wrong selection?
See, you cannot deny the fact that homeopathic medicines have action which is very deep. So
Yes.
that is also one of the reasons why, especially in skin cases, you must refrain from prescribing at all if you are not sure, because there is a very good chance that if you have made any mistake in selection of medicine, and especially when you are giving a partial similar medicine, it will surely produce suppression, because skin disease are the most easiest to suppress
Hmm.
because they are on the most superficial part. So in skin disease, rather it seems easy to prescribe, it becomes the most difficult part because you have to be extra cautious, because then your wrongly selected medicine will surely cause suppression.
Okay.
There are nowadays we have a special mention for vigilance in terms of adverse effects. There is an ongoing so many, you can say, searches, as well as the government is also in continuous efforts to, just like in modern medicine they are collecting the data as to adverse reactions. With homeopathic medicine also data is being collected, what kind of such adverse reactions are taking place with use of homeopathic medicine. But it becomes very difficult to exactly pinpoint which particular prescription of yours has produced which type of suppressive effects or bad effects. That is one hurdle which a homeopathic physician usually faces. First of all, he uh, doesn't, or he's not able to many a times recognize itself that he has produced an adverse effect.
Yes, sir. Okay, sir, we have next question. How about the treatment of osteomyelitis?
Sorry,
It's a very wide spectrum of discussion.
what is the question?
He's asking, how about the treatment of osteomyelitis?
Osteomyelitis.
Yes, sir.
Right. It will require another 1.5 hour of
Yes, it is a
individual
the
sessions.
wide
It won't
spectrum
be.
of discussion.
It's not a question of discussion here, I think.
Yes, sir. So, any other questions? Okay. Okay, sir, I think that's all for today. And if any other question left from the audience, you can ask on the comment section where this session will be live on the YouTube of Homeopathy 360. You can ask your question in the comment section also. So I think that's all for today, sir. Thank you so much, sir, for your valuable time. And we have gained knowledge about pathology and homeopathy very well. And thank you so much again, sir.